Daniel Water Program team on behalf of the World Bank to welcome everyone to this. This is the 5th webinar in the series of webinar that we started already in March this year in response to the change environment in which we are all working. So, Daniel Water Program is EAVD and the World Bank supported activity that was focused on developing and strengthening capacity, primarily in water supply and sanitation services, expanding to water security also recently. And usually we'll do this through the number of direct or indirect interactions between team members, consultants, and the different water and sanitation stakeholders in the region. Now, the whole pandemic that has hit not only our region, but the whole world has forced us to come to the mode of continuing building the capacity without being able to physically meet any of you. So this is where this series of webinar came from, and this is the 5th webinar. When we were thinking what it still has not been covered until now, we decided to focus and to make the topic of this webinar detecting and managing COVID-19 in sanitary wastewater. I do believe that, by a certain point, we are a little bit saturated with all informations about the COVID, but we consider it's important to try to bring to you as our participants and our listeners a few top European experts who will somehow inform you about the most recent development in detecting and also managing and dealing and eliminating COVID-19 from the sanitary wastewater. This whole crisis is not only wastewater and sanitation crisis, it's also a public health crisis. So we try to bring together care for the public health, advances in water technology, and advances in academic findings and developments over the last few months. I would probably like to finish by saying that enormous amount of technical, scientific, technological advance have been made over the past period, but we are still all learning. So this session is also opportunity for some of the very prominent experts from Europe to share their experience and for all of you, including myself, to learn something about it. Today we have with us Mr. Damir Brjanovic, who is my colleague, friend from IIG Delft, Professor of Sanitary Engineering, Mr. Dragan Savic, who is the CEO of Kiev KWR Water Research Institute from Holland, and Mr. Norbert Kreuzinger, who is Associate Professor on the Institute for the Water Quality, Technical University of Vienna. My name, one more time, because I haven't introduced myself properly, is Stjepan Gabrić, and Senior Water and Sanitation Specialist in the World Bank, and I will be moderating this webinar. Our aim is to be quite short. This will last 120 minutes, not longer than this. So this is a very compact format, which will be divided in essentially 2 groups. First will be 3 presentations, 1 from each presenter, and then we'll have roughly half an hour for the dialogue. You will be able to post your questions, and I will now let Katya, who is our host from Vienna, to basically explain what is the optimal way how you can post your questions during the webinar itself, including during the presentation. Katya, over to you.
Thanks, Stipe. I see a lot of you on the chat already, but if you haven't found it, you can hover your mouse over the images of our panelists here, and you'll see a number of icons that come up. One is a blue icon that has the little chat blurb. If you click on that, the chat should pop up on the right. When you're addressing your chat, please address it to all participants so we can all see the conversation and keep everybody engaged. There's a drop-down menu, and sometimes it's a little bit hidden. If you scroll all the way to the bottom, you'll see all participants, and you select that, and I will be able to see your chat, as will all and attendees. So thanks for joining, and we look forward to hearing from you in the chat box.
Thank you, Katja. With that in mind, let me give a floor to Mr. Damir Brjanovic, Professor of Sanitary Engineering from IHE Delft, a person who knows much more than he will be able to tell you in 10 to 15 minutes, but I'm sure it's going to be interesting and entertaining for all of us. Damir, please.
Thank you very much, Stjepan, for this nice introduction, and thanks for inviting us to this opportunity that we can present some of our innovations and ways how we deal with outbreaks and specifically with the COVID-19. Also, I would like to welcome all visitors to this webinar, and I see people from Barbados, from South Africa, and all over the world, which is not only for, let's say, Eastern Europe region, but also a global event. So, not to waste much more of my precious minutes that I got, my topic of today is a part of the demos concept. The demos concept will be presented today in two parts. First part will be presented by me, and that one will be more about, let's say, decentralized sanitation and the toilets and a treatment of COVID-polluted sludge or wastewater. And the second presentation will be Professor Dragan Savic, who will cover the sewer part and integration of all these components in one concept that we call demos. And demos is a very new concept. We developed it in the past weeks, putting all knowledge that we have into something meaningful and hopefully helpful for the society. Demos stands for Digital Epidemic Observatory and Management System. And the first part is part 1A, talking about a Medilu. Now, what is a Medilu? Medilu is, in fact, a smart toilet that you can place inside and outside of the home. The examples that I will show you in a minute are examples driven by humanitarian reasons. There where we got the funding and initial funding to develop such a concept. And however, this Medilu approach is equally applicable in modern homes as well. So the modules or the toilet bowls, as we know them in the modern houses, can be retrofitted into a Medilu type. So that means that this toilet can be applied in a sewered and non-sewered areas. And that is an important point to mention. Now, where it started, actually, it started, in fact, about 10 years ago, when we got inspired by the humanitarian agencies and listening to their problems, we tried to address these problems and designed something called ESOS, a smart toilet. That toilet had original purpose to improve operation and maintenance of a system, to research into behavioral aspects of using the toilets, and especially if they are put in a public or outside of the home settings, and to find out some important design aspects of it, which deals with the load to the toilet and frequency of cleaning and emptying the toilet from the fecal sludge and urine which is accumulated in that. So on the picture, you see the first ESOS experimental setup that we tested in the refugee camps in the Philippines in 2017. And that research has been funded by Bill and Melinda Gates Foundation and Asian Development Bank. We tested in this setting all kinds of smart functionalities, and they were all working. So we were very happy about that. And we moved also into development of a very interesting software which could really monitor what is happening in the toilet without intruding into privacy of the users. What is important to say that all the toilets that I will show it to you today have very little need of cooperation of the people using the toilet. Everything is smartly positioned and incorporated, and also the privacy issues are well taken off. I will show it to you these considerations in a moment. So this software is connected with the GPS and GSM arrangement, and we can monitor from the Netherlands what is happening in the toilet in the Philippines, for example, or at any location where our toilets are positioned, even if they are in the homes, if you want to have that. And you will see later why you would like to have it. The next level was inspired by the first success in Philippines, and we got funding from the Dutch ministry to develop that idea further. And we developed the prototype, the full-fledged prototype of the toilets. And two of these, the red and blue, are tested in Kenya, in Nairobi, and tested with a great success. So here also we tested all functionalities like we did in the Philippines. And what is interesting, that we got lots of information from this toilet related to the users, and users were codified in this case. We didn't know the names, we didn't know anything about these people, we only know the code. So we could get from the use of the toilet information like their weight, the amount of urine that they release per use, amount of feces produced. We could also get very detailed graphs of defecation and urination, which would, you may be now laughing a little bit like what these crazy guys are doing. But believe me, from these graphs, we can find out if somebody has, for example, diarrhea. And diarrhea is a very important symptom that can let's say, indicate number of different diseases that people may have and having a symptom diarrhea. So we came up with the idea of how can we use this data with additional data to predict the medical condition of the user. And that's how the Medilu idea was generated. And we got in touch with the JJ Consortium, who became the leading partner in this development, and a team of partners who helped us to develop this concept into a Medilu concept. So what is that Medilu concept? It is the idea of having a toilet inside or outside of the house. On this picture now you see a version that is outside of the house, but the interior all equipped with the sensors and other facilities that we have in that toilet can be placed in any toilet. And we are working on that arrangement as we talk, to have also a homemade model that can be placed inside the home. So the main task of this toilet is to, thanks to all sensors and all technology which is installed inside the toilet, we can predict some diseases. We can pre-diagnose that the person has some disease or not. So how does it work? So it works in a way that we generated something called Medilu configurator. And on your screen, you see that we have, in fact, 8 steps in that configurator. The first step is that we select, for example, the target group. It can be citizens, it can be tourists, refugees, pilgrims, passengers in a plane, doesn't matter. So these are different groups, it can be extended. And then we have the reason of the how we use this toilet. We can do it for acute snapshot screening, acute early warning epidemics, and this is a concept that I'm talking today, and about chronic longitudinal monitoring of people's health, which is nowadays called very nicely precision health. The next step is to deal with the privacy, and there are different arrangements there depending on the target group. And of course, the ethics has to be considered. And we have all teams of people and doctors who are now dealing with ethical and privacy concept. The next slide is the key slide. On the left-hand side, you have a list of all kinds of diseases that we think that such a toilet can pre-diagnose. Here, we didn't put COVID-19. COVID-19 I left for the next slide. So we'll see the whole range of specifically tropical diseases, but also many of these diseases also happen in Europe, which is not a tropical, like hepatitis or obesity or anemia or pneumonia and some others. Then we have all kinds of symptoms, and you see the whole list of symptoms that we can indicate in such a toilets. And we have also parameters of interest: temperature, stool and blood, urine, blood, heartbeat, weight, length, eyelid, eye white, skin, breath, and so on and so on. And we need a technology. And we are dealing with the most advanced technology, with the sensors, with the optical identification cameras. We use hyperspectral cameras that are used by NASA and the European space agencies, and we are downscaling them into something which is affordable and scalable to our needs. Urine analysis, which is a common test, and lab-on-chip technology. So here you actually choose what you want to equip your toilet, and then the toilet will be able to deal with these diseases and with these symptoms that you choose, and therefore we call it configurable. Now, in last month, we are all influenced by a COVID, and you see beautiful picture of this nasty virus in front of us. And as we talk, we are developing a method that is non-invasive method that can detect a COVID infected person. Actually, it's not infecting a person, but it's not identifying a person, but it's identifying a COVID in the person. So as it can be also anonymous used to the toilet, still the user can get information that he or she is infected. What is important that this analysis that we are now developing is non-invasive, is instantaneous, and it is at individual level. At this stage, we cannot disclose more details about this new method that we are developing because we are at very sensitive research stage of it, and any disclosure might harm the process at this moment. But we think that we have a very elegant reason to identify a person different than what has been done so far in the world. That brings me to some publicity. I just show you one article from the Netherlands. The Dutch people can read it, and one from the Croatian papers from a couple of weeks ago. Those who can read Croatian can find out that the title says, "The toilet discovered diseases. Should it also a coronavirus?" Now, we also wonder, but we are quite confident we will be able to do it relatively soon. Then, the second part of that concept is, imagine you do have a coronavirus in one or another form, in a sewage or in a sludge. This form is probably different than the form of active virus. It's maybe a viral type of that, which is RNA present in wastewater. Doesn't mean that virus is active or that it's dangerous. Nevertheless, we developed the technology, and I will spend my last few minutes on this, on something that I call the shit killer. I'm sorry to the people who are sensitive to my vocabulary, but this was the word which was generally accepted as such, and only in some countries we are advised to use other name, and I think it's just hypocrisy. Anyway, we go into a shit killer, and what is that? It is, as we also call it, technosanitizer, for those who excuse my English. It is a novel microwave-based pathogen destroyer and a sludge dryer. You see in front of you a unit that we built in Slovenia with support from the Dutch government and Bill and Melinda Gates Foundation. And that unit, the core of it is a microwave system which actually kills all pathogen in the sludge, including viruses. And after the longer exposure of sludge to the microwave radiation, we also get a drying. So you get reduction in volume and very safe sludge. This system has been tested very recently in Jordan. We just completed testing before Corona outbreak. So in that sense, we were very lucky. If you see on these bottles, these are all pieces of materials that we took across our concept. And the concept doesn't only treat sludge, it also treats water to the level of demi-water. So it's even cleaner than drinking water. I would say not recommended for drinking, of course, but you can reuse this water for any, let's say, horticulture or agriculture purposes. It's free of pathogens, it's free of metals, it's free of anything. And what is more importantly is that we got very dry material, up to 95% dry material. You see the material below. You don't need mask to deal with this material. You don't need gloves to You can do it if you want, and we of course recommend that, but this material is totally inert. And we have not tested it with corona at this moment because of the entire issue with the traveling, but we tested it before on other pathogens, and we destroyed all these pathogens. And given the temperature of 105 degrees, and plus the impact of the microwave radiation itself, we do believe that any sludge that we would put in would be also corona-free, because it also destroyed other viruses which are even more difficult to destroy, more encapsulated than corona itself. So that brings me to the end of this presentation. The shit killer was inaugurated actually in Croatia, in Rovinj, in last year, in 2019, and has received lots of attention, as you can see here in Istria, and some other newspapers in Zagreb were also talking about that. If you don't know Croatian, it says shit killer. Bill Gates was delighted about our machine for treating feces. So yes, this is what I want to tell you, and the continuation of my talk will be with Professor Savic, who will put the other things on top of it and will integrate what I just showed to you. And of course, I'm open later for questions. Thank you.
Thank you, Damir. We'll move now to Mr. Savic. So, Professor Savic, the floor is yours.
Thank you, and thank you everybody for joining this webinar. I'm just opening the page to share my presentation. Well, it's a great pleasure that I can join you today. Basically, I'm continuing on what Damir has presented. So I will be talking about sewer surveillance or wastewater epidemiology and how it's related to this demo system that we were talking about. I come from KWR, which is this research institute in the Netherlands. And the motto that we have is bridging science to practice. So over 10 years, this wastewater epidemiology has developed into a very mature field. And we've been doing this for the European agencies by looking into wastewater and seeing what are the chemicals that we release through sewers. And it's quite interesting, and obviously illicit drugs are one of the key areas that we've been working over the years, and that's where the idea of looking into wastewater epidemiology and COVID-19 came from. So from those biomarkers, from what we release and ends up in the sewer, we collect sewer samples over 24 hours. So it's a composite sample that is then analyzed by DNA analysis. So we're talking about genetic analysis. We are matching the RNA genes of the virus so that we are very sure what we are finding. And then we are combining that with the public health information, testing and tracing apps in the public, in order to get much better situation and understanding. So let me give you an example. We've been doing this for 5 cities in the Netherlands. And in the graph here, we can see that the first measurements were starting on the 29th of February. And the first detection was very early in February, and this is the orange line representing what was found in the sewer. So on the left, you have logarithmic scale of the number of gene copies per milliliter of wastewater. The blue line is the average line of the number of people that are tested in public, so tested by medical professionals, and is an average of number of people ending up in hospital. So you can see a very good agreement between the three curves. And the idea is that by tracing it in sewers, you cover much larger population, because we can do for entire city of Amsterdam in one measurement. And also that in one case, we detected virus in sewers 6 days before the first reported cases were known. So then a group of us made a team that competed in the recent EU versus virus challenge that happened in April. And basically we developed this idea of digital health observatory that is doing everything from the sewer. And then Damir and I spoke, and we generated this idea: why don't we put everything together? The Medilu idea, the wastewater surveillance, and we could have a system that works perfectly in developed world, where everything is sewered, everybody is connected, or most people connected to sewers, and also works on the other extreme in the area where there are no sewers. But wastewater has to go somewhere, so you have open ditches, and also the use of Medilus. We are getting into faster, cheaper, and better decisions about how to deal with the pandemic. So we are talking about preparedness, early warning system, hotspot discovery, and mitigation planning. And over 48 hours, we developed a prototype that includes Dutch data, so you can see different municipalities and different colors representing different concentrations of the virus. And then we also developed some models using AI and optioneering to give us an idea how many deaths can we expect if we don't do anything, or if we implement certain activities. So the blue line represents flattening of the curve, reduction, or cases appearing much later in the process. So this is a scalable platform. That was just a prototype. In order to develop something for a country or for a city or a small municipality, we require about 3 months of development. The idea is to have a public website where people can check some of the information, but they don't need everything. Those who need it are first responders, those in charge of organizing response to the pandemic. And this is just to show what kind of data we envisage using. And in this particular case, we were using sewer surveillance data, so the data that is collected from sewers and then analyzed for the number of viruses or concentration of viruses, then clinical and epidemiological data. So this is coming from medical professionals. Then we look into socioeconomic data. For example, age profiles of people in the country or in the area. Are they all older or younger population? That will depend where the resources are needed more. And other data, social media, people are tweeting and using Facebook to complain about symptoms, and we can combine all of those together. And then adding to that is the Medilu idea. So together with all of those data sources, we decided, we developed this concept of DEMOS, which is Digital Epidemic Observatory. And just in one slide here, I can show you that we are, first of all, we're looking into all areas of the risk management cycle. We are helping preparedness. How are we doing that? Well, we will have a system that will give us an early warning system. We have a system that we could play with different interventions and see which ones would be better for potential pandemic. Then we can plan the response, mitigation measures, and the recovery. We can decide or help people decide when to release the lockdown situation. So here we have in the middle, say we have a sewered area, so these people are connected to sewers. Then we have areas that don't have sewers, like and you can always find that in low to medium income countries where people are on the fringes. And then we can actually do the measurement, take the samples from the system, or take the samples from collection points. These are all collection transfer points for sludge. All of that can be combined with weather remote sensed information and sent to the cloud. We have a system that will optimize where to put the sensors. We will use a local lab. We will not always have to send the lab samples to the Netherlands or any other countries. There is always opportunity to do that. And then we will develop a web-based apps so individuals and group users can actually access it and have this decision support center. We have a website, and I will put the link to the website for you after the presentation. So with that, I'll finish my presentation, and I'm happy to answer any of your questions. Thank you for your attention.
Thank you, Professor Savic. So this was an interesting view and concept developed by our colleagues from Netherlands. Let me now switch to Norbert Kreutzig, who is coming from TU Wien, Technical University of Vienna, to give us insight about scientific development and experience that his team and TU Vienna managed to develop over the recent period on this COVID in wastewater. Norbert, you have to switch on your mic, please.
Sorry.
I can hear you now. Thanks.
You did it for me?
Yes, I did.
Okay, thank you. So thank you very much. Sorry for this interruption. Thank you, Stepan, for introducing me, and a special thanks to Dragan for introducing the topic in regards to the connection of the detection of the SARS genome in wastewater. And I guess you all must be very enthusiastic after those two talks, and that you really present what is possible today by modern means, really combining all technologies that we have available, from treatment technologies, from different sensors, from integrating, from modeling. Artificial intelligence was a topic. And actually, I guess when I listened to that, I said, wow, this is just great. And I'm grateful that this vision was presented, and what I will try to do right now in my presentation, to some extent, on the one hand, give you an impression what we are doing in Austria in regard to that topic, and the other, a bit of problems we may face when we go into that direction, and when we really want to produce a meaningful tool that can be applied on a broader scale. And the time is very limited, so I try to bring certain points to certain aspects to the point. So basically, we in Austria have established a consortium that's called Corona. End of March, actually two institutions independently looked at the topic of coronavirus genome in the wastewater. So this was colleagues from the University of Innsbruck, and that was us in the east. And we rather soon started to join forces together and approach the topic together beginning of April, and then even got in contact with international groups on that. In parallel, we quickly established contact to various ministries, and what was very amazing for us to see that all of the people approached from the health side, from the Ministry of Agricultural Regions and Tourism that are responsible for the water issues in Austria, the Ministry of Education, Research and Science, they all were very enthusiastic about that and supported us from the very beginning and said, well, go for it. This is a really important and meaningful approach. And so we were able to allocate some financing for doing our research too. So this is basically what is going on in a research group. So we have a very broad expertise from sewer modeling all the points until to the treatment. We have microbiologists, molecular biologists, so a whole bunch of people involved. And what we additionally have, and I think this is very important, that we are in direct information exchange with the involved health boards. So we have this task force in Austria that's coordinating all the measures and release and stringent measures. We are in direct contact and exchange with them. Distributing information, getting information, and discussing our approaches that we have, just to make sure that what we are working on is really what is meaningful for the decision makers, and that we produce results and answers, give answers to questions that they are interested in. A very brief thing, because always when I discuss with people working with wastewater in the one or other way, there is the question, is this a problem? Is the existence of the virus in the wastewater problem? Well, the general agreement on top level is no. And the simple explanation is we need this intact spike proteins to dock to a receptor so that we really have the infection. And we assume, or the assumption is, that in the natural environment of wastewater, this spike protein is deteriorated, so it has a different structure. It cannot dock anymore to the receptor, and that's why we don't have to be afraid of infections. So this is just a side approach, because quite a lot of people, I guess, would be interested in the statement if this is an advanced problem. So when you stick to the traditional, normal hygienic rules working with wastewater, you shouldn't be exposed, or shouldn't be have more problems than normally. Another thing that is important, I think, is just to get an understanding how does the virus gets to the feces. So this is very simple. On the one hand, you have the die-off of cells due to the infection process, but you have regeneration processes of the epithelium in your lung, in your upper respiratory parts. And especially when you sleep, you have something like a cleaning process going on. So small hairs in the trachea transport slime towards your larynx, and that you swallow. And in that slime, you have the virus particles, and by swallowing them, especially when you are sleeping, it's getting into your digestion organs, and at the final ends then to your feces. Just to understand how or why we are able to detect a virus that is basically infectious for the respiration tract. So when we now go into detail and follow something like the procedure, the standard operation procedure for detecting the virus in the wastewater, actually we are not detecting the virus, but we are detecting the genome of the virus. That's already a big difference. This is RNA, and we only detect this RNA in the wastewater because the virus particle, so the envelope is still there, so it's not destroyed. The virus capsule does not break up, otherwise the RNA that gets out of this capsule, it would be degraded immediately under the wastewater conditions. So that's why we can be sure that we still have the viral particles there. But again, as the spike proteins are somehow changed due to redox conditions and other stuff, they have a different look and cannot dock anymore to the receptor bindings. So when we look at the different steps in our workflow, we have a lot of uncertainties and a lot of questions that we get. And let's start at the end here with the PCR, so the final detection method, because those parts here are the most accurate ones, and those that really can be standardized. You can work with internal standards, so you can spike, so you get really a very precise measuring result. It's actually similar to chemical analysis, where this part is very accurate. But, and this is the big part, and I think this is the big but for the whole approach, we have here other aspects that start with sampling, go to storage, sample preparation, and so on, that we are not sure how that all influences our final number. So even when we get a very accurate number at the bottom, at the end, when we consider the whole approach, the whole operational procedure, then it's at the best, it's some semi-quantitative results that we get. And we have to ask the question, what questions can really be answered by semi-quantitative results? So not really a number that you get where you say, this is the true number, but considering all these degrees of freedom and uncertainties in advance, have a direct impact and influence on the results. So just to give you a few examples, so this is something like the excretion curve. So it's considered to be something like double sigmoid. So you have a sigmoidal approach. At some point you get sick, but you're already excreting, as already Dragan said, before you really get sick. And this is what we would call the window of opportunity for reactions here. Where you really can react before people go to the hospital, get hospitalized, or show up some ill diseases. And then at some point they get healthy again, and they still excrete the virus for a certain time period, but they are healthy. So we don't know really how long those phases last. We have a certain idea about, but not really concrete data. Of course, we can imagine that for different patients that looks different. So each individual patient has a different excretion curve. So we have to consider the physiology. So maybe a man with 100 kilos has a different tissue volume that can be infected. So more virus excretion may be compared to a girl with only a quarter of the weight of the other man. So when we get a signal in the sewer, can we attribute that signal to one person that has a stronger weight, or is a high weight, or is this rather several people that have a different physiology, or is this the excretion of one person on top of his infection, or is it the excretion of 10 people at the very low already final part of their of being sick. And then, as we know, we have different severenesses of COVID. So when we get a certain measuring number again, is this from one person that is really sick, or is it from several people that are less sick? And this is just a few aspects. And here, when we speak about recovery from wastewater, what's about dilution in the sewer? How many people are directly defecating in the sewer system? What's about stormwater? What's about degradation? What's about long transport times in the sewer system that would flatten the peak? What's about the type of sampling, the impact of sampling, and so on? So at the end of the day, we have a lot of questions where we are not 100% sure, or for some of them we don't have any idea at all how that influences or impacts our measured value at the inflow of the treatment plant. So just what we are doing here in Austria. So we started already end of March with investigations. We have 2 sampling points, one in Innsbruck and one in Vienna, that we really have a very tense temporal resolution. So Innsbruck at some point sampled daily. We sample in Vienna 2 times a week. Then we have other cases like the brownish ones that we sample every 2 weeks, and some of them that we sample occasionally, mostly because we didn't find a signal for 2 times at the beginning, and then just stopped sampling because it was just creating a lot of samples, and it takes a long time to process the sample. So this is another limiting factor. Some preliminary results. So as already you can imagine, everyone is trying to hide the very actual and recent data. So in that case, this is what you see here is the situation in Vienna. So the black line is the number of positive cases per day. The red line is the new infections per day. So you see the peak line, we started around here and have now solid data since the beginning of April until recently. So we are still able to detect the virus in the inflow of the treatment plant. Evaluation for us means that we usually take independent biological replicates, and we analyze both replicates not at the same moment, but with a certain duration in between, just to make sure that we can repeat the results independently with other samples, with other extraction, and that we really, because of the sensitivity and sensitive nature of the questions, we really can be sure that we don't provide wrong numbers. A similar situation is in Innsbruck. Here the colleagues went already one step farther, trying to figure out a very easy to approach and implement a traffic light system. So when you have for several samples, following samples, you have positive results, you have a red light. When you have samples negative, positive, so shifting around, so around the limit of detection, they give them a yellow light. And when you have several samples, one after the other, where you don't detect the virus, then you give it a green light. So this is basically some of the first results we have. So just to wrap up, there is a lot of expectations in the topic, in the topic of Corona in wastewater. The hopes are that we get a nice picture or a better picture about the dark numbers in the background. So when we don't have a very high testing rate, the expectations are that we get some better prevalence data, a number of infected peoples, but we have some limitations, I would call them now, and some of them are really tricky ones that we would have to look into detail. And that sums up to a certain potential, what I'm really sure and convinced what can be done. So we definitely will be able to use this approach for trend analysis. So whether the number of the detected virus gets higher or lower, more or less, I think this is something that we can really say for sure. I'm sure that we can provide some complementary methods for established approaches that the task force in the various countries really would be keen to use. We can definitely monitor the management measures, whether they're meaningful, so whether, or when you have relief measures, whether this is leading to an increase of certain of the virus in the wastewater. And I think even when you, for example, think about larger companies, remember the media from Germany, with the budgets where they had a big hotspot, a new hotspot. So it could make sense when you have a huge company, let's say with 2,000 people working there, that you regularly monitor their wastewater to get an idea whether you have some infections there, or whether the close working of people together is without a problem. So, and what is definitely for sure what we can do is when we lose our signal in regards to negative signals in the inflow of a wastewater treatment plant, and for a certain time, once in sudden we get a positive signal, we observe the virus again, then this would give us some early warning options and in close contact with the authorities, with the health authorities. So basically that's my contribution here. Again, I think it has huge potential, but we still have a high number of uncertainties that we really have to look in detail before we can apply. And the problem is that, of course, we need the information, the approaches right now. So at least we have to know what the limitations of the methodology is and what we really can be sure of, and what is a bit of a problematic answer that we give to certain questions. So thank you for your attention.
Thank you, Norbert. Dear participants, dear attendees, we have approximately a little bit less than half an hour for a dialogue. You can post your comments, less questions on the chat format on the right side. Let me start with Damir, because he was the first one. There is a question related to standardizing, or actually trying to comply this MEDILU with ISO standards. Has anything been done in that direction? And then the question also related to how safe is for wastewater treatment plant operators to perform their daily activities compared with the regular level of safety measure that they were taking a year ago. Okay, so we have now additional threat in the wastewater, particularly concentrated in the sludge you were dealing with. Are there any additional safety requirements, measures that are needed that treatment plant operators need to pay particular attention?
Thank you, Stepan. Do you hear me, Stepan?
Yes, we can hear you.
Yes, okay. So the first question is very relevant, and will be going into that direction. But at the moment, our priority is there to make MEDILU work that it's really can predict the certain symptoms and diseases with a high accuracy. And that is the real, let's say, the priority at this moment for us. ISO standards will come into the consideration. They are already now in consideration, but they will be really addressed once we start building up the new concept when it becomes commercialized, hopefully sometimes in the future. Then it should be complying with all necessary standards, including ISO standards that colleague mentioning. And I'm familiar very much with the ISO standards and the place where they are testing them and how they came up and so on. And I appreciate the work of these colleagues on standardization of sanitation equipment. The second question was about should wastewater treatment plant operators be concerned about corona? Now, it's my personal opinion. So I don't represent here opinion of my company or institute or anybody else, but I would say not necessarily, because there should be no more precautions or safeties that normally plant operators are doing. Coronavirus is one of many viruses present in wastewater. It is only it's new and still unknown how to deal with that, but the risk of contamination is not less or not more than the risk of contamination with any other viruses in wastewater. You find viruses in wastewater regularly, and the RNA, that was another question there, if I can answer now in one go. The RNA that present in wastewater of viruses can be found survive for a long time. Even for more than 100 days, I found some information on RNA, but doesn't mean that the virus is surviving for such a long time. Virus can probably survive 2 to 4 days. And the hydraulic retention time of virus of water in a sewage is depending on the situation, but it's not longer than, for example, 1 day retention time in a sewer system, and probably 6 to 10 or maybe 18 hours in wastewater treatment plant. So the virus will pass the treatment plant as such. Where it can remain is in the sludge. So, but my message is, we shouldn't be so much worried about virus RNA present in a sewer system. You find lots of RNA of dead people in the graveyard, and doesn't mean that these people are alive.
Thank you, Damir. Immediately related to this question, I mean, this treated wastewater, which in Europe, at least most of Europe, is actually not disinfected, has been discharged in the rivers, lakes, etc. Could we then also draw the conclusion that actually this does not create immediate threat for example, people, swimming for recreational, using water for recreational purposes, at least not more threat than any other wastewater discharge would create?
Is the question again to me, Steph?
Yes.
Now, this is difficult to answer, but what I said, we have regulations in many countries for discharge of treated effluents in open waters, as well as discharge of pre-treated or untreated effluents. Just say, for example, in Croatia, you have a regulation that you need to secure that the area on the beach, 300 meters from the shore, if I am well informed, should be safe, and that holds also for corona. So if other viruses cannot reach the shore, I don't see that why coronavirus should be a better swimmer or more resistant. But research has to be done. But coronavirus is just one type of coronaviruses, which have been quite extensively researched in the past. So I don't see any kind of specifics here so far that would say that this virus is more difficult to survive or more easy to survive in harsh environments, in salinity water, exposed to the sun, especially at higher temperatures. Okay,
thank you, Damir. Dragan, question to you. I mean, the solution, the concept that you have presented includes different. It's multisectoral, includes also different players, from the health authorities to the academia, to the companies, to the municipal, local governments, etc. Do you have any example, at least in Holland, that this kind of cooperation has been established? How does it work? How do they get involved?
Thank you, Stipe. That's an interesting question. Maybe I should say that we are in the process of working with the European Joint Research Center, JRC, in Italy, to spread this technology or the type of testing to over 50 capital cities in Europe, capital and large cities in Europe. And we are collaborating with as many collaborators from different countries in order to achieve that. Just to mention that in all the samples that we have taken before the wastewater treatment plants in 5 cities over a long period of time, we haven't found one active virus. All of those were fragments of viruses, so they were deactivated. So obviously, precautions have to be taken everywhere, not just in wastewater treatment works. But your question to Damir, and Norbert may be able to answer that question, address that question as well. But we in the Netherlands haven't found a single active virus in the wastewater, even before treatment. So when you release it after wastewater treatment intervention, I don't think there is an increased risk for the water bodies in the environment. Let me just say that we work very closely with the Dutch National Institute for Health and Environment, RIVM, and we are asking all our European partners to work with their own health national organization so that we can get the comparison between what we find in sewers and what is detected by medical professionals.
Thank you. Let me immediately follow up. I mean, you mentioned this, your initiative, your activities. We can see that people in Austria are following. I would expect that similar kind of efforts are ongoing in a number of European countries.
All around the world.
Exactly. Okay, but even if we focus just on Europe, is there any kind of coordination, or is everybody kind of working to gain certain knowledge on its own? What kind of exchange of information and knowledge actually exists in the academic community?
Well, there are lots of initiatives through Global Water Research Coalition, through the American Water Research Foundation, for us to come up with a common protocol that everybody will follow. The question that Norbert asked, how do you save or store the sample? For example, people were freezing samples and then they were losing the information from it. So at what temperature, how to transport it, all of that, how to take a composite sample. Are you taking a composite sample? Because some organizations are thinking about comparison, full composite sample with spot samples and then see what the differences are. And I would expect there will be quite a differences there. So yes, there are lots of research questions, but the trends, the basic idea of early warning system or understanding at what point you may relax the measures could be gleaned from the information that we've gotten up till now.
Thank you. Norbert, over to you. I mean, you mentioned particularly Innsbruck in Vienna. Both of them have a strong university, from technical university. Do you see this concept, this program expanding and growing in covering more Bundeslands in Austria, or how do you actually see, in the case of Austria, how do you actually see it develop?
So I want to follow up on what Dragan said. So it's really I think this situation now is a very good example how the scientific community on global scale is working together in a quick pace. So it only lasted maybe the 1 or other week that everyone somehow met and via the networks that are really coordinated themselves on a worldwide scale. So it was amazing to see how quick that happened and how open the information exchange even happened. So when it really counts, then I think the scientific community is able to really join forces and see see the bigger goal to direct to. So it's just as an addition in regard to what's going on and how things are coordinated. So this is definitely going on. Even GRC, so the European Union is putting an effort here in coordinating approaches. So in regard to Austria, so well, to be honest, the biggest problem right now is the time you need for the sample processing. So it's a bit of a limitation that is there. So you really would have to think how many samples you can handle per day. And this is very much depending on your resources. So basically all the federal countries, everyone is in the boat of this Corona project. So we have not only the ministries, we have the countries there. We have the commitment of the larger cities to contribute with samples with on a regular interval and on when we just want to have it. We are in contact with the health authorities that tell us there was a hotspot popping up in that municipality, have a look on it. So this of course is only afterwards. So what I mean is that this is a very, especially or despite the fact it's a new approach, everyone is very cooperative, everyone is very excited. And it helps actually to put the whole sanitary engineering wastewater side into a complete new picture, because until now it was just wastewater, something there. But now people see that there is much more behind it, and that wastewater epidemiology can really contribute on a completely different level, and this brings up new opportunities and even a new standing for the whole topic of sanitary engineering in general.
You know, when I was looking at the presentation of your samples, I think it was for Innsbruck, there were negative samples, or actually green samples, and then red samples. How certain could you be, based on the number of samples and the way how you are taking samples, that this green is actually green, that you haven't simply missed the virus?
We can't be sure. Exactly. So you have a certain sensitivity. You know that we have a certain limit of detection. But what the reason for your final result is, whether you lose on the way from the sewer to your PCR result. If you lose 10, 100, or so 1, 2, 3, 4 orders of magnitude, you can determine for the last step, basically. So for the PCR, so you can have this internal standard, so you exactly know how much of the signal you lose. But this is only from the when you start with the or after the RNA extraction step. So there are ideas to add, when you take the wastewater, you add a certain amount of a unproblematic virus that has a similar characteristics, or where you assume that you have a very similar environmental behavior in regards to size, in regards to adsorption, in regards to die-off maybe, that you put into your sample and then co-extract with your sample. And at the end of the whole procedure, you say, well, my final determination result was 10 units, but you had 1,000 units put as internal standard into the procedure, so you're losing 2 orders of magnitude. And then you assume that you lost 2 orders of magnitude for a virus too. So this is all something that is still going on, but the final steps are validated, let's put it that way. But if we really have lost something during the sampling, or that we have, when you do time proportional samples, for example, that you're taking your water, your wastewater sample for in the inflow, and then you have a small peak just passing by that you don't sample. This is all something that has to be modeled and that has to be considered.
Is it possible to use antibodies as a source of determining the level of contamination beside the virus itself, or part of the virus?
I saw the question in the chat too. I don't know, to be honest. Other people than me would have to answer that. how to say, my experience with wastewater is that this is a very very complicated matrix. So it's much more complicated in regards to chemical constitutes and equilibriums and redox conditions compared to groundwater or even surface water or even blood. I really have no clue if we have that much of competing chemicals or structures in the matrix of the wastewater that we really would succeed in using that approach. So
Okay.
I wouldn't expect that this would be possible, but I'm not the expert in that field.
Okay, there is a question that I'm also personally interested. How much are like global institutions like World Health Organization aware of what is happening? I assume they have information. And how much of, is there any thinking to make this kind of technology presented here, this kind of investigation, this kind of analysis, kind of a mainstream, widely used and applicable tool? I mean, this question for all three of you.
To start with, this approach is not really completely new. So it is already used from WHO for the determination of poliovirus. So there is a program to extinguish the poliovirus, and since years, the prevalence of polio in the population worldwide is monitored via the sewer epidemiological approach. So this is actually now with the corona, it's nothing that is completely new, and the approach in general is already known. It's just now the urge and then the promising approaches that could be provided, that it really gives that strong focus and let's call it a hype, a worldwide hype that's going on. And actually, we see within the next few months if this really is suitable, if we can transfer the complexity from the scientific academic level down to a simplified approach for the operators. Because it makes no sense to have a high sophisticated scientific solution that cannot be implemented. When we speak about monitoring a city of, let's say, 1 million people, and you would need 200 samples a day, this is just not feasible. You cannot handle that amount of samples. So we really have to come up with a pragmatic solution for that may be accepted, and knowing what would be the shortcomings of that, of course. So it has to be optimized.
I mean, it seems to me that we are very much in dynamic phase. As I said, 4 months ago, we would not be even thinking about talking about this. Now we are discussing this. We'll have to wrap up. We have 5-10 minutes left. If I can give each of the presenters 3 minutes, if you can briefly summarize what is your expectations, what is the future, what will the future bring in this particular field? How do you think that this whole technology and approach will develop? Maybe Damir, to start with you.
Thank you, Stefan. It's obvious that the problem is not only exclusive to coronavirus. Coronavirus is only now bringing so much attention, which is this crisis we also have to use to bring forward science and practice that is relevant also for non-corona issues, so that we put approaches and methods together and the concepts that are not only applicable for this situation, but to have a wider spectrum of epidemiological applications, be coronavirus, cholera, SARS, or whatever we can expect, what we experienced in the past and what we can expect in the future. If the concept is there, then it's only a matter of techniques that we adapt quickly to the coming crisis, and we are ready for it. Now, what this conversation today also shows that we can use a lot of existing technologies which are already there. The beauty of that is that we have to develop certain additions to that and to combine the existing technology into new purpose. And the new purpose, like we try to do it in a demos. And what I want just to conclude there, seeing the questions here that unfortunately not all were answers, but maybe we can stay later and answer them so that in the version that you will publish, we have all answers to all questions. So people can look to that. But to come back to my point is that indeed, when you look into sewer system, there are issues. There are issues about credibility of the results, and a big challenge for us how we can correlate what we find in the samples with what is really happening in the city. This is a challenge. At this stage, I think we will be very happy to deal with the trends. That if we see the trend, that is already a signal to whoever, authorities, to take precautions. And even if it's a false alarm, better to be, false alarm and then not be sorry later. And additional thing that maybe was not presented so strongly at the beginning was that if we succeed to complement the results that you can obtain already now from the sewerage with existing technologies and analytical methods, with the new methods of discovering corona instantly and not taking any obvious sample from the people like we are trying to do at the Medilu, then we can develop studies. I understand what my colleague is saying about you cannot cover the entire city with all certainties. But if we have a pilot project in which we can isolate certain part of the city, that we can really know what is in and out, from the point of the sewage to the point of the toilets in the houses and in hospitals or whatever is there. And if we can verify the data from the sewage that we get and the data that we know exactly how many people go to toilet and how many people are infected in a certain area, then we can make these correlations on this pilot, and then we can extrapolate these equations into areas where we don't have that luxury of having such a detailed study.
Thank you, David. Dragan, over to you. Final thoughts, recommendations, views.
Just very briefly, through this particular epidemic, we have realized how quickly we can move in terms of digitalization. And I think what Damir was also saying is that we could then, through digital means, integrate all of these technologies with the uncertainties that we have. There is no foolproof system that will do everything 100% true, but we can improve the state of knowledge that we can without the sewers. So we need this technology together with digitalization, and I'll finish with that. Thank you.
Thank you, Norbert.
Well, for me, it was really amazing to see how quick the scientific community responded and how quick the networks popped up supporting each other with buddy systems. So people coming up, I want to do something, but I can't. That you say, well, but I know this person, so ask him, maybe he can support you. So for me, it was really amazing to see this joint initiative of the scientific community and how quick that occurred. I think this is really a nice scientific challenge for a lot of questions, and we need a lot of expertise from all various fields to really come up with a nice solution. So this is a good example for inter and transdisciplinary approaches. So even when you work with satellite data for whatever, or with people from demography and so on, and bringing them together under one umbrella is needed, and I have the feeling that we may succeed with that.
Thank you. My concern is that, academic community obviously is very much engaged. I'm sure that even from the field of water technology, we can provide adequate answer, both in interface as well as developing technology. Unfortunately, but fortunately for this technology, I'm afraid that this crisis will last sufficiently long that will require continuous support to have this technology developed. Because what we have seen with some other cases like Ebola or like previous SARS, similar virus, that once the virus have disappeared, the interest, funding, and the resources have also disappeared. Unfortunately, but fortunately for this particular case that we are now mentioning, it's all indication is that this is going to be with us for some time. And based on this, the interest, pressure, and funding as well will remain on this particular topic. So it's really my expectation that a year from now, we will have certain level of standardized procedures and technology use, which will combine detection, monitoring detection, management, and then basically using this for health services. I believe we all agree about that. Now we are running out of, actually we over the originally scheduled time. Kathy, let me know. Do we still have 5 or 10 minutes because there are more questions that we have managed to answer, or should we close the session?
I think it's up to you guys. If people want to stick around, they can stick around as long as they want. If they have places to be, they can go. But meanwhile, if you guys want to continue, you can go ahead and answer some questions.
Yeah, I mean, if Damir, Dragan, Norbert, do you have additional 5 to 10 minutes, or okay? Fine. Okay. So I mean, we will with this. Let me try to close the formal part of the webinar. So as I said, this is the 5th webinar in the series of the World Bank Danube Water Program webinar. We'll continue working with this because it proved to be useful platform for knowledge exchange and knowledge dissemination beyond even Danube, much beyond Danube water region and Europe as well. So please continue to follow our news. We will keep everybody informing about next webinar. So this is the end of the official part. Whoever can stay, there is a number of questions put on the chat format. Dragan, Norbert, Damir, if you want to pick up any of the question posed there. I have to admit, some of them are so technical that I'm not even able to comprehend them myself. Obviously, asked by the specialists themselves. So if you want to choose any of the questions you think it's worth also here reflecting on.
I think I saw at least 2 in regards to that people would like to look into the topic, but there are issues on the analytical part, or that maybe the sample volume is not sufficient and so on. So in regard to technology, so I guess Dragan is with KWR here, KWR here the leading institution to answer that. But I guess I would say that now we already have some idea where we could stop the SOP. So when you cannot, for example, perform your PCR immediately, where we can stop. And if you don't have any other option at all, so as a last chance, you always could freeze samples. So we know this is not recommended and it's not good and you should avoid it. But when this is the very, 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 very last option, then you should do it. And you are not alone at that planet. So I'm sure that within the next 2 months, we will have a protocol that would allow to analyze frozen samples without losing too much information.
Stepan, maybe I can volunteer to answer 2 questions.
Please go ahead.
Or at least to address them, maybe not to answer them. Mr. Bojitar Dedush is asking, it's at 3 hours 58 minutes that you can trace it. It's asking about, what about these innovative approaches, and what about the second wave, and can we use these approaches, and is WHO aware of this approach? So the last question, I don't know who is aware of what, but I think we should work on promoting this awareness, like this webinar. And it will be really good that such incentives come from the organizations who have a huge reach, and not necessarily to judge if approach is correct or not, but just to inform others about different approaches, so that people get aware, and especially the decision makers, because the other top question was at 405. It's about it's a political question that I wouldn't like to enter, but I would just like to say that many governments, what I see on TV, are basing their decisions on evidence-based decision making. At least the Dutch government I think most of their decisions based on the evidence, as much as you can collect in a short period of time, including the information that they get from institutions like ours, including from the other sectors. So these are made, and I would advise that other governments continue making their decision, also listening to the practice and to the experts from the field. And I'm sure that it's happening in many ways. And the last one that I think I could tackle is the question from Nyoman Suartana about what can we do to protect us from virus in wastewater. I think if you probably if you listen carefully what we said so far, there should not be at least no additional risk that of contamination directly from wastewater, because the chance that you will get with the wastewater in many places in many countries is very little. When you are talking about low and middle income countries, specifically suburban areas, slums and informal settlements, you get that risk there as well, equally as high as the risk of other pathogens and other viruses which are harmful to human life. So everything that you do so far, you should continue doing in terms of protection, and nothing specifically, nothing specially when it's about wastewater, because there we don't see the largest potential of contamination and the spread. The potential comes from the direct contacts and from the person-to-person spread, as far as I know.
Thank you, Damir. Dragan, do you have any comments you would like to address?
Maybe just about the link to WHO, because we are also the collaborating center for health and water quality at KWR with WHO. We've been in touch with them, but they are so snowed under the requests from national governments and various, so they cannot deal with this right now. What Norbert said, I would expect in 2-3 months' time, when the things are getting a bit more normal, that there will be a movement to get this general idea across, that we can trace stuff through wastewater epidemiology, and that we could use it in making these informed decisions. So that was my kind of contribution to one of the questions there. Thank you.
Thank you very much. I believe this is kind of nice sum up, nice final word of this present. There is technology which is still being developed, which shows a lot of potentials, but it has to be adequately adopted, supported, and then it could provide valuable tool for assisting protection of public health in coordination with academia and water technology companies. One more time, thanks to all of our presenters, to all attendees who've been with us, Katya, who've been our host, and guys, stay safe, stay sane, take care about yourself. Hopefully, a year from now, we will look at what we have achieved and how we have contributed to fighting this pandemic. Thank you very much. This is the end.